everyone, welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here are what we have for you from the world of medicine. How lifestyle pattern changes the outcome of prostate cancer. A recent study in the European Urology examined whether men at an increased genetic risk of prostate cancer can offset their risk of disease or disease progression by adhering to a healthy lifestyle. The findings suggest that a genetic predisposition for prostate cancer is not deterministic for a poor cancer outcome, and maintaining a healthy lifestyle may provide a way to offset the genetic risk of lethal prostate cancer. The study prospectively followed around 12,000 genotyped men in the health professionals and the physician's health study. Genetic risk of the prostate cancer was quantified using a polygenic risk score. A healthy lifestyle with weight, vigorous physical activity, not smoking, and a healthy diet were the inclusions. A total of 3,005 overall prostate cancer and 435 lethal prostate cancer events were observed. The polygenic risk score enabled risk stratification not only for overall prostate cancer but also for the lethal disease, with a four-fold difference between men in the highest and the lowest quartiles. Among men adhering to a healthy lifestyle, it was associated with a decreased rate of lethal prostate cancer compared with having an unhealthy lifestyle, translating all this to a lifetime risk of 1.6% among the healthy and 5.3% among the healthy people. Adhering to a healthy lifestyle was not associated with a decreased risk of overall prostate cancer. Hence, these findings suggest that a genetic predisposition for prostate cancer is not deterministic for a poor cancer outcome, while maintaining a healthy lifestyle may provide a way to offset the genetic risk of lethal prostate cancer. The lingual mucosa procedure, its benefits and its outcomes. Management of a long proximal ureteral stricture is equally challenging. Lingual mucosal graft ureteroplasty is a novel, minimally invasive technique for ureteral reconstruction that avoids the morbidity of bowel interposition or even autotransplantation. The study evaluated the long-term effectiveness of lingual mucosal graft ureteroplasty for managing long, complex proximal ureteral strictures in a multi-institutional cohort of patients. The findings of the study are published in the European Urology journal. This retrospective study involved data for 41 patients who were treated with lingual mucosal graft ureteroplasty that was performed using either an onlay ureteroplasty, in which the diseased ureter was incised ventrally and repaired with a lingual mucosal graft to widen the urethral lumen, or an augmented anastomotic technique in which the obliterated segment of the ureter was excised and re-anastomosed primarily on the dorsal side, and a lingual mucosal graft was placed on the ventral side. A total of 41 patients, 40 were operated with laparoscopic procedures and 1 with a robot. 24 patients underwent an onlay ureteroplasty and only 17 underwent an augmented anastomotic urinoplasty. The reconstructed ureter was wrapped with omentum in 90% of the cases. The median stricture length was about 4.8 centimeters, operative time was 166 minutes, and estimated blood loss was around 65 ml. No open conversions and intraoperative complications occurred, and at a median follow-up done for about 35 months, the overall success rate was 97.6%. The lingual mucosal graft ureteroplasty is a safe, feasible and effective long-term technique for managing long, complex proximal ureteral strictures. This rare autoimmune disease and the worst cardiac outcomes of this particular condition. A recent study was performed to evaluate the impact of cardiological disorders on the outcome of myasthenia crisis requiring ventilation. The study threw some light on the fact that hypertensive cardiopathy, atrial fibrillation, as well as ischemic heart disease, all these increased the risk of non-invasive ventilation failure in myasthenia crisis, all those who were receiving ventilation. The study is published in the Acta Myologica journal. The study included around 90 cases that were admitted to the neurological unit. All patients were eligible for a non-invasive ventilation trial. The effectiveness of cardiac comorbidities on the outcomes was analyzed, which were the need of invasive ventilation, the risk tracheostomy for weaning the failure, and the duration of the ICU stay. The females in the study were 58.9% and males the remaining. Patients were classified as early or late. according to the age above or below 50, while 85% of the patients were anti-acetylcholine receptors antibody positive, and hypertension and cardiac diseases occurred at the diagnosis in 61 and 44.4% respectively. Invasive mechanical ventilation was needed in 34% of the cases. 9 subjects underwent tracheostomy because of weaning failure. Independent predictors of non-invasive ventilation trial failure were atrial fibrillation, either parasitic or even persistent, hypertensive cardiomyopathy, as well as ischemic heart disease. Hypertension had no statistical effect on the outcomes, and hypertensive cardiomyopathy was a predictor of this weaning failure. The researchers hence concluded that hypertensive cardiomyopathy, atrial fibrillation, as well as ischemic heart disease all increase the risk of non-invasive ventilation failure in myasthenia crisis, all those who are receiving ventilation. A rare case of Parkinson's disease known as the methanol-induced parkinsonism and its outcomes. The most common cause of methanol poisoning is through ingestion of adulterated alcohol. However, other routes of poisoning may also occur, including the cutaneous exposure and rarely inhalation. A case reported in the BMJ Neurology Open represents an unusual presentation of an incidental methanol intoxication through inadvertent inhalation while manufacturing homemade perfume. It also highlights an additional yet unrecognized finding of cerebral artery spasms as a sequel of methanol poisoning. A woman in her 30s living in a rural area of Saudi Arabia was referred to the tertiary care facility for the management of sudden vision loss and even Parkinsonism. The patient makes a living by manufacturing local perfumes at home, and to compensate for the increased demand for her product, she admitted to using adulterated alcohol from a different local vendor. She was admitted to a local hospital as a case of encephalopathy with optic neuritis, and she required intubation. She was misdiagnosed as having an autoimmune encephalitis, for which she received a course of pulse methylprednisolone followed by intravenous immunoglobulin G. The brain MRI showed bilateral and symmetrical areas of bright T2 site. The frontal and the occipital lobes showed bilateral, symmetrical, subcortical, hyperintense T2 signals with heterogeneous contrast enhancements in addition to the enhancement of the optic nerves bilaterally. There was significant rigidity and bradykinesia. A sensory examination was unremarkable to all the modalities as well as cerebellar examination. Her gait revealed a decreased arm swing bilaterally with a shuffling gait and mild postural instability. The estimated unidentified Parkinson's disease rating scale 3 was 50. The preliminary diagnosis was methanol toxicity due to the nature of her disease progression and typically the radiological examination. The patient was denied any history of taking alcohol. Results showed to have found a high concentration of methyl alcohol. Symptomatic therapy consisting of carbidopa, levodopa and pramiprazole was started with a gradual increase in the dosages. Parkinsonism symptoms resulting from methanol poisoning were managed by the use of dopaminergic agents, as was the case with the patient who showed a fair response to levodopa, carbidopa and pramipexole. The case highlights the increased need for awareness on the part of the public and the healthcare authorities with regard to the manufacturing as well as the use of homemade perfumes produced with poorly processed alcohol having a high methyl alcohol content. So people who make handmade perfumes, please be careful. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.